What is the state of diabetes in the Caribbean, and how have our health systems responded? The Caribbean islands have some of the highest proportions of persons with raised fasting blood glucose, that is greater than or equal to 7 millimoles per liter in the Americas. The prevalence rates range from 14.5% to 8.7%. Blood sugar control is poor throughout the Caribbean, and many persons are unaware that they have diabetes. Some countries are without enough of the essential testing services for diabetes. Additionally, persons living with diabetes are at high risk for severe illness and death due to COVID-19 infection. The pandemic disrupted routine health services for persons with diabetes, and Caribbean countries sought creative ways to ensure access to essential services and medications for persons with diabetes. Countries have done population surveys to understand how diabetes is affecting their population and have introduced public health programs to help lessen its impact. CARPHA has provided its member states with relevant help in their response to diabetes and other NCDs. In 2019, CARPHA, in collaboration with the Organization of Eastern Caribbean States, the OECS, with funding from the World Diabetes Foundation, updated the CARPHA guidelines for the management of diabetes mellitus in primary care in the Caribbean. Through a grant from the Agence Française du Développement, or AFD, CARPHA has shared the guidelines throughout the Caribbean via webinars and train-the-trainer workshops.
Hello, good day. My name is Dr. Dia Brathwaite. I work at the Barbados Diabetes Foundation, and I'm coming to you today just to share a little feedback on the Train the Trainers program for diabetes management in primary health care. This is a training program that was held by CARPHA, and it was designed to bring together care providers from all over the region with various backgrounds. The course allowed us to visit areas such as primary diabetes kind of guidelines, recommendations for screening, diagnosis, management, referral, medication procurement, guidelines for persons who are caring for persons living with diabetes, and some other topics, making it very varied and quite interesting. So my suggestion is, should you have the opportunity to engage with the training, by all means, I would recommend that you take it up.
Countries should have an essential list of medications that are affordable and readily available. Module 4 focuses on the appropriate use of medicines and what factors should be considered that could affect access and the availability of essential medicines. The module also includes information on the medical supply chain management framework. Systems should also be put in place to protect the integrity of the available medications. CARPHA advocates for universal health coverage, where all persons with diabetes have access to the health services they need, when and where they need them without financial hardship. This includes access to safe, effective, and affordable quality medicines, mental health, exercise, prescriptions, nutritional counseling, and self-management programs. CARPHA encourages the implementation of the guidelines to standardize the management of diabetes mellitus in primary care across the Caribbean to ensure the region's healthcare workers have the skills to provide quality, people-centered care. Governments should develop national policies and programs that increase access to foods low in salt, fats, and sugars, with increased access to fruits, vegetables, and locally grown produce. Governments can use several evidence-based tools such as CARPHA's 6-point policy package, SACE's Model Sodium Reduction Framework, and the World Health Organization's NCD Best Buys. Help prevent diabetes by engaging in regular physical activity, eating a healthy diet, avoiding the use of tobacco, the harmful use of alcohol and other substances, and maintaining your ideal body weight. Together, let's beat diabetes. Healthy people, healthy spaces, healthy Caribbean. A message from the Caribbean Public Health Agency, CARPHA, with support from the Agence Française de Développement, AFD.